Hi, good evening. Okay, so when I'm explaining range of motion to a client such as Fearless, I would definitely talk to them about the ability of the body part to be fully flexed or extended, and I will explain that range of motion testing will test how far they can move their body part around their joint. I will also demonstrate it before so that they'll really understand the full meaning of what it is. Okay, so when I explain manual muscle testing to a client, I will explain that I'm checking their strength, I'm checking the contractibility of their muscle, and I'm going to be telling them that I'm going to be giving them opposing manual resistance, such as when I'm going to be holding the body part, I will tell them I'm going to try to push you, don't let me, and I'm going to explain to them there's grades and there's different levels of strengths if they inquire about that. Okay, so the assessment of choice that I picked was the stereognosis test, where I'm going to be explaining to the patient exactly what's the purpose of the test, and that it's to check the sensation and to check stereognosis. First I'm going to ask the patient to close their eyes, and I'm going to place different objects in their hand with different textures, and the client should tell me within 2 to 3 seconds what it is. I'm going to be checking the same thing on the other side, and I'm going to make sure that it's they identify it accurately, and that there is no and that the findings are not due to language or cognition problems, and that the deficit is actually due to impaired stereognosis. The assessment of choice that I picked was a stereognosis test, where I'll be asking the patient to close their eyes, and then I'm going to place an object in their hand, and I'm going to ask them what object it is. Typically, it should take them about 2 to 3 seconds to figure out. So deficit would be if they are not able to guess what it is.